A warm welcome to this talk, Friday the 7th of June. Now I want to do some more coverage of the Scottish COVID inquiry. This is an excellent inquiry, and the counsellors on it, the lawyers on it, are asking sensitive questions and getting information from ordinary people, people's ordinary experience, not high-powered politicians, just people that experience things and often suffered during the pandemic time. And it's a pity other countries aren't doing the same. Now, things are coming to light that are pretty uncomfortable, alarming even, from the Scottish inquiry. Now, this is not because things were particularly bad in Scotland, we don't think, but other countries which aren't carrying out the inquiry, of course, they're never gonna find out. So, important lessons to be learned for Scotland and everywhere. Now, I want to listen to a witness statement from Robert Pollock now, clinical advisor paramedic, and he worked as a frontline paramedic during the pandemic. So over to Mr. Pollock now.
And the final thing I wanted to ask you about then is do not resuscitate. That's a section of your statement that's dedicated to that, paragraphs 26 to 30. And you talk about a practice, I think it is, of toe tagging. I just want, and a letter that you as paramedics or the Scottish Ambulance Service received. Could you just elaborate a little bit on?
I actually tried to find the correspondence now via, I couldn't find it, to be absolutely blunt. However, my recollection is absolutely clear. There was discussions around age grouping for toe tagging. But in other words, people over a certain age now, your normal attempts at resuscitation would be minimised. And as a consequence of the discussions, they were mentioned 70 and over initially.
I mean, in paragraph 28, you talk about rumours that the government, and I assume you mean the Scottish government, but I'd be grateful if you could clarify, had a plan to reduce that age group you were talking about to the over 50s.
Yeah.
Did that ever amount to more than rumour? I mean, as you'll appreciate, we're obviously looking at the Scottish government's strategic response.
It was absolutely in discussion now, and they had a kind of 70, 60, 50 now escalating process, and it basically said that they realised there's tough times ahead, and if you had to work out your normal levels of professional expectations, they would support you greatly. And the way it was worded, I think the only interpretation that people could make would be now relative to this situation regarding not giving now your full attempt to resuscitation certain patients, depending on the age or condition in some places. And for example, if you personally are a paramedic and your mother was 75 or 80-year-old now, what's going to happen now if they take unwell? I have no knowledge of what figures, what people suffered this detriment now, as in lack of attempt. I have no actual figures, but I do know it was discussed now, and it was a possibility, and the fact it was a possibility caused a lot of stresses and pressures.
Well, I hadn't heard of that expression, toe tagging, an appalling expression, I must say. But there we're talking about people not being resuscitated after a particular age, which of course is patent ageism. Now I'm going to read a few of the points from Robert Pollock's statement that is in the public domain. There was reporting in the media of toe tagging of patients by age group, which is wording for do not try too hard to resuscitate them over a certain age. By default, if a patient does not have a DNR in place, we should try to resuscitate them. And this can, to be fair, result in inappropriate resuscitation sometimes. Resuscitation is not always appropriate. We shouldn't be officious in our use of resuscitation. We have to be very selective, but the key thing is it should be done on an individualised basis, a highly individualised basis. Robert Pollock goes on, Scottish Ambulance Service employees received a letter by email on the 26th of March 2020 from Health and Care Professionals Council, which stipulated to every registrant that they realised there would be difficult decisions to be made by healthcare professionals, but they would be given full support to make decisions without or out with normal protocols. Not exactly clear what that means really, is it? Ordinarily, efforts were made to try and resuscitate every single person that has a feasible chance of success. However, Health and Care Professional Council basically indicated that if employers did not do that on these occasions to coincide with a government statement, then they would fully support employees for any challenges employees may face as healthcare professionals. So it sounds like if they didn't resuscitate people, the management was saying here that they would support them. That's what it sounds like. He goes on, this was very frightening for workers who have family members in that age group, and it caused a lot of concern and anxiety for people who were used to doing their best to preserve life. The process of resuscitation has evolved and we have a high success rate, which of course is very much to the paramedics' credit. But this did not go down well with members. In addition, there were discussions about rumours within meetings of the Scottish Ambulance Service that the government had a plan to reduce the age groups to those over 50s if COVID levels reached their expected peaks, and the plan for over 70s did not result in a significant enough drop in medical demand. So these senior managers really, by this stage, should have had a better understanding of how severe the pandemic was going to be, because they were given full information at the time. We didn't have full information. And it sounds to me like some decisions were made far too quickly. Almost, of course, we don't have the full information, almost like a panic reaction. But this is the whole point. We need more information. We need to do qualitative research on this and then get quantitative figures out of it, because Mr. Pollock said he didn't know how many people this affected. But that information could well be derived. And again, we're not going down on Scotland here. This is a problem that probably applies to many other countries as well. With age dropping depending on the number of patients coming through hospital, it really is quite alarming that people who are in middle age potentially would not be resuscitated. Staff morale was severely affected as they were trained to preserve life. They were paid lifesavers, but at that time they were told to do the complete opposite. This terrified staff that they might have to do this against their normal training and their normal desire to help. This was not a process that anyone welcomed. So it would be good to get the people that sent out these emails, what was their thinking? What was their thinking based on, and what was the rationale for what they were doing? Now, Not for Resuscitation is only one example of things that of thinking that wasn't optimised, I believe, in the early stages of the pandemic. We've looked at previous examples of excess use of midazolam and morphine, for example. So very important to learn the lessons from this so that we can move forward. And next time there's a threat, let's hope there's less rapid decision making. Let's hope there's no panic in any future threat, and let's hope that rational, cool heads can prevail in any future situation. Not saying that wasn't the case here. We don't have full information, but if we learn from this to inform future difficult situations, that would only be a good thing. More from the Scottish Inquiry shortly. That they are talking about excess deaths, so I'm hoping to get some work on that. And again, Dave, independent researcher, has sent me some information on that, which I'm hoping to get time to look at. Shall we do some frivolity? Yes, I think we shall. I'm going to show you some video I shot last week or the week before on a day off of a waterfall near where we live. It's called Air of Force. Well, there you go. Hope you found that enjoyable. No substitute for getting back into nature to try and recalibrate the brain. It doesn't always work, but it's better than not getting out at all. But for now, thank you for watching.